I'm really excited to talk to everybody today about thinking about building short-term and long-term relationships with agricultural producers in their areas to better serve farm workers. And so again, just for anyone that just joined, I saw quite a few people have just joined. Dr. Anabel Rodriguez and Dr. David Dufresne are joining us from UT Health Science Center, and my name is Bethany, and I'm here at NCFH. And I do need to apologize ahead of time. I'm presenting from my house, and I am a small farmer, and we have lots of roosters really close to my house, so I'm sorry if you have farm background noise. All right, well, NCFH is doing a 4-part series of webinars, and our main goal really with all of these webinars is to give you guys tips and resources on what you can do to better serve farm workers in your area during this pandemic, and then also to provide a platform where we can dialogue and share ideas and strategies. For those of you who don't know us, we are the National Center for Farm Worker Health, and we are located in Central Texas. And our mission is to improve the health of farm worker families. And so a lot of what we do is help provide training and assistance and support to health centers that are serving farm workers all across the country. Okay, so I'm gonna very briefly go over about what is happening with COVID on rural areas and on farms. And then I'm going to give a couple pointers in terms of finding producers, but I'm going to leave most of that for David and Annabelle to discuss. And at the end, we're going to try and reserve about 10 or 15 minutes for questions. And you guys, feel free to type ideas or questions in the chat box as you think of them, and we'll review all of them at the end. Okay. Sylvia, could you bring up the first poll question? And I'm going to talk about our campaign while folks are answering that first poll question. So while Sylvia brings that up, NCFH has had a campaign now for about 5 years to really try and get all farm workers and their families served by health centers and have a primary, healthcare home. This is a really fantastic campaign. We're about to see over 1 million farm workers and their families served last year by health centers. And so if you would like more information about this campaign, you can email us at the end of this presentation.
Okay, I have launched the poll questions. You should see that on your screen at this time.
And Sylvia, I don't know if I will be able to see the results. So if you don't mind, after a little bit, if you don't mind reading those results for us.
Sure. And I'll give everyone about 5 more seconds to submit your answers, and then I will close the poll. Okay, everyone should see the results on your screen. Okay, it looks like 42% answered A, health center. 30% of you answered E, education, university. 12% answered D, direct services, social services organization. 9% volunteer or private healthcare services, and 6% farm worker advocacy organization. And if there is another category that describes your organization, you can enter that in the chat.
Thank you, Sylvia. And now we have one more poll question to go over to just get a good idea of where you guys are at in terms of building relationships with producers. So Sylvia, if you could go ahead and bring up that second poll question, that would be great.
Okay, that should be on your screen at this time. I'll give everyone about 30 seconds to respond before closing it. Okay, the results are on the screen. Looks like we had 37% answer D, have current relationships with producers. 33% answered they do not have any relationships with producers. 30% answered B, we have had limited interactions or contact with producers, and no one answered C.
Okay, great. Good. So we really tried, we kept that in mind that you guys might be coming from kind of a lot of different places in terms of working with producers. So we've tried to incorporate tips for people that haven't reached out to producers before and that have established relationships with them. And for those of you who feel like you do have, good established relationship with producers, please feel free to chime in the chat box anytime you would like to share an idea. Okay, let me see. All right, Sylvia, can you see my screen again?
Yes, Bethany, I can see your screen.
Perfect. All right. Okay, so let's talk a little bit about what's happening with COVID in rural areas. Many of you live and work in rural areas, and we've seen a lot of media coverage on what's happening in urban areas. But I thought it would be good to take a moment and talk about what's happening in these rural areas. Epidemiologists are thinking that a lot of rural areas will experiencing the peak of their pandemic quite a bit later than the urban areas. It depends on where you are, but that may be in July or August. And we saw in mid-March, the first rural areas that were getting hit with coronavirus cases were primarily in vacation destinations like Vail, Colorado. And that started happening in mid-March. 3 weeks later, coronavirus cases were reported in over 2/3 of rural counties in America. So it has spread really rapidly in rural America, even though we're not seeing the as high of numbers in those counties as in urban counties. I want to point out here that the highest case rates are in some of those vacation towns, but also on American Indian reservations. And there's been some pretty good media coverage about what's been happening on those reservations. And I think it's very relevant for us who work in farm worker communities because a lot of the same factors are at play. So for example, the Navajo Nation has really been getting hammered with COVID cases. And a major factor in that is that about half of Navajo Nation residents don't have running water. So those of you who work in farm worker communities and you know that water access or potable water access is an issue, it may be good to follow what the reservations are doing right now to deal with coronavirus cases, and it may give you a good idea of what is to come and how to prevent cases in farm worker communities. Another big cause for concern for public health officials is that rural Americans on average are quite a bit older than their counterparts in urban counties, and they also have a higher burden of chronic disease and higher smoking rates. So this image is a map. This was published last week in the New York Times, and all the counties shaded orange are rural counties that have reported coronavirus cases. One more major factor is that those of you who work in health centers or with health centers in rural counties, you guys may be really the only line of defense for people who are getting sick in rural areas. And this is because we have a lot of rural hospitals closing in this country. And last year was actually the worst year so far for rural hospital closures. So you guys are a really, really critical part of the healthcare defense against this in rural America. Okay. When I was researching information for this webinar, I really wanted to be able to get some numbers on COVID cases on farms, but unfortunately that's just not possible. And now the Department of Labor has given some, has basically told employers that they really don't need to track COVID cases on the work site. So we don't have any hard numbers about COVID cases on farms, but we do have some information. Before I jump into that, I wanted to briefly share with you guys sort of how this pandemic and some of the shutdown has been impacting farm operations. And it's really been a dark spot for farmers in kind of a long string of rough years. As you can see on this slide, the prices for a lot of our staple crops in the country have dropped quite a bit since the beginning of March. And on this next slide, the prices for milk and cattle and hogs has really started to drop really fast. So this has had a big impact on farm income and on potentially on farm layoffs. And these price drops have happened for a number of reasons, but really one of the big ones due to this pandemic is because so many of the farms and the processors that they sell their produce to can no longer sell very much to restaurants or to the education sector. And even though we're seeing an increased demand, at the grocery store, Americans eat very differently when they cook at home versus going out to eat. So they want different things. They don't eat as many vegetables when they eat at home. And so everything's just kind of been flipped upside down, and our food system is just so complicated it can't respond that quickly. Another major issue that some of you may have seen recently in the news is that there have been a lot of really large outbreaks of COVID cases in meatpacking plants, and that's happened in a number of areas. It's happened in Iowa and Maryland and South Dakota, and some of these are very large. For example, the Smithfield pork processing facility in South Dakota, the cases in that meatpacking plant were about half of the cases in the entire state. So this has become a really big cause for concern for the workers in those meatpacking plants and in the surrounding rural community. And as you can imagine, this is going to start affecting farms. Just yesterday, I was reading about a poultry farm that now has to slaughter 2 million chickens and not process them because there aren't any workers to process the meat. So this, again, may have a big impact on farm operators' ability to hire workers or, provide them with any kind of benefits. Lastly here, I want to point out that H-2A workers are still coming into the country. That visa program was briefly frozen in March, but it has now they're pushing it through again, although it is largely limited to H-2A workers that have had those visas in the past. But I want to point out that because I think everybody should be concerned about their H-2A workers in their, in their area, because they're not undergoing any sort of quarantine when they're coming into the country, or even necessarily once they get to their employer's work site. And we know from research that there are some transportation issues in terms of being able to get off the farm and get access to health care. And really recently in a survey that was done with them, about half said they had overcrowded and unsanitary housing. So as you can imagine, that's a big issue for coronavirus transmission. So when you're looking, if you're one of those people that you guys don't have relationships with producers yet, you may need to find the producers. And a really easy way to do that is to start with H-2A employers. And that's because the Department of Labor publicly lists their employers' names, their phone numbers, their addresses, how many workers they have certified. And so you can find that information for your area very easily. Farm labor contractors are also a great place to start, because again, the Department of Labor requires that those folks be registered, and they list quite a bit of information about them publicly as well. And if you need help finding this information, just shoot me an email. I'd be happy to help you find some more of this information. And I know David and Annabelle have some more ideas about this as well. And this is our NCFH, on our NCFH website, we have a map that you can look at. It has H-2A worker employers all around the country, and you can search for your county or just zoom into your area to see where H-2A workers might be. Okay, so just to emphasize one point here, and I'm going to pass it to Annabelle, but make sure that you are succinctly emphasizing the benefits that you can provide to the producer. Right now, it's not only a stressful time for farmers, but it's also an extremely busy time, since a lot of planting or harvesting in the South is going on. So emphasize what you can do for them, and you guys have so much to offer them. And also make sure that you are communicating to the employer that you will not be bringing COVID to the farm, that everyone will be safe, and that you just want to make sure their workers have access to healthcare during this time. Okay, you guys have these slides. I'm going to go ahead and pass it off to Annabelle so that we can have plenty of time for questions at the end.
Annabelle and David, I'm going to go ahead and unmute you. And I'll transfer the presentation over.
Can y'all see the slides?
Yep, we can see them. Can y'all hear me?
Yes, we can.
Fantastic. Okay, great. This is Dave Dufresne here from the breezy and cool but sunny San Antonio. And similar to what Bethany said, it's my luck that the lawn crew just showed up to our neighbor's house. And so I'm going to be trying to speak above their machinery that they're working out there. It really is a pleasure for Annabelle and myself to be able to present to all of you today. It has been one of my professional aspirations to try to work more with all of your organizations and in where we are in the ag community, because with the producers that we work with, we are increasingly hearing from producers their desire to offer more health and safety services to their employers. We are increasingly hearing that they are appreciating the benefits of having a healthy workforce. And so we're going to talk a little bit about that. We're going to tell you a little bit of our experiences working in agriculture. Myself, like what was presented, I've been working in agriculture for the past 20 years. I grew up in this Dallas. I'm a city slicker. I had to learn agriculture just from my professional experiences. And so I'm the deputy director of the Tyler Ag Center, as well as associate director of the Colorado Ag Center. So I straddle two different NIOSH funded Ag Center regions. And the most of Annabelle's and my work has been in dairy as well as logging, but I have been confronted with several farming operations. Annabelle has her personal experiences having grown up down in the Texas Valley, working with her family out in different ag settings. And so we're very well in tune with the ag producers, their perspectives and what they do and what their needs are. And so I'm going to present the first few slides, and then Annabelle's going to take it over from there and carry us across the finish line with this short presentation. So Annabelle, if you could go to the next slide. Okay, and so just to kind of follow up with what Bethany presented, these are challenging times, especially in agriculture, as it is across all industries across our nation. Unfortunately, our economy has just slowed down nearly to a halt, and that affects so many different industries, and it affects, ag. Ag is not immune to this. And so you can look up online all the different news sources, and I just put up a few of these, but you really have to understand the supply chain of agriculture to really get an appreciation of what these producers are going through right now. Like what Bethany said, we have schools that are not serving as many meals every single day. We have restaurants that have closed down as well. And in some ag sectors, that means up to 50% of the demand. And so when you take that away, now you have a huge supply that the nation is trying to figure out what to do with. In livestock, especially in dairy, which is what we are more familiar with, there is no switch on the cow to turn off the milk production machine. And so the dairy industry is trying to come up with ways for individual producers to slow down milk production. The government is intervening as well, but that is why you are seeing milk being dumped across farms across the country. In one state that we work very closely with, we're hearing reports that farms are having to dump between 500 and 750,000 100 liquid pounds of milk. That equates to about 15 to 20 tanker trucks that milk is just having to be dumped. Crops are often not being harvested as a result as well. Bethany brought up the poultry processing plants. If you just think about it, the whole supply chain is set up especially in poultry processing, that the chickens come in at a certain age, at a certain size. Well, if these chickens are not coming in at a particular size, then it really throws a wrench into the whole machinery processing angle of what goes on in these processing plants. And so you really have to think about all of these different ramifications of diminished demand. And eventually, because of this slowed down demand, workers are being affected in the sense that many ag workers may be, excuse me, losing their jobs down the road. So it's very important that you understand the whole industry and what is going on. And so whenever you do go out and you are speaking to producers, you need to understand the business and the financial hardships that they are going through. And there is a lot of fear. There's a lot of trepidation going on with the workers themselves. They know what's going on. They know what the ramifications are of this whole situation, and there is fear among those workers. Next slide, please. So like I said, you need to understand the producer perspective, and I'm going to kind of talk about our historical experiences working with the industry over all of these years. And Annabelle's going to follow up, and she's going to talk about more immediate strategies that you might be able to take to gain access to workers for you to be able to offer your services in whatever ag sector that might be in your markets. But most of our experiences has been in dairy, and for 20 years, our approach to gaining access to these workers in dairy has been just spending time on farms, getting to know producers, getting to know the associations, and understanding how they do the job. Again, I was raised in Dallas. I had no ag production background. I had to ask a lot of silly questions among dairy owners, dairy producers. But as you will soon encounter, as many of you, I saw the poll responses there, many of you have not been able to go out and make contact and generate partnerships with producers. One way for you to do that is just to go out, shake hands, and just start asking questions. And I cannot think of a single other business owner than the ag producer for them to really enjoy explaining how they do their job and how the food that is put on our plates and our table gets there. Because what I am observing across our country, that up until COVID, people really did not understand how that food magically appeared on the shelves and it magically appeared on our plates. And so producers, they are very proud of their business and how they produce the products that we do enjoy, the cheap food prices that we enjoy in the grocery store. So my recommendation to you, I encourage you to get out and start meeting producers, going to the different trade association, their different local meetings, their conferences, and especially those that are in your specific markets, and just asking questions, getting to know them, offering to come out and meet with them on site, and just not only to ask them what they do, but for you, that gives you an opportunity to start presenting your services and your existence and your mission of providing health services to their workers. And once they understand that and producers see the value of what you do, then they're going to be more willing to allow you to come on their sites of operations and allow you to provide your services. You have to keep in mind, over 90 to 95% of many ag operations in the U.S. are still privately owned. And so these small businesses do not have a human resources department. It's oftentimes the owner or the producer, maybe a spouse, helps out with the overall management. And so you have to understand, it's a small business operation that does not have the luxuries of bigger corporations that oftentimes have human resources and the resources to offer different types of health-related services. So what has worked for us is just gaining trust, building relationships, building partnerships individually with each business owner, and creating and fostering those partnerships and maintaining those partnerships. Annabelle will present later in the slides. Sometimes, you know, if it's not a research-related activity, we will just cold call producers, and we've gotten to the point where we know managers on many of these operations to where we have relationships with them. The owners trust us to where we can have direct relationships with managers and supervisors, and we can call them up and we just ask, how are things going? What are the issues that you're seeing on the farm? Is there anything that we can do to help you out? If we don't know the answer, we're going to find the answer for you, or we can hook you up with someone else, like a clinic like each of you represent. In the present day environment related to COVID, producers are beginning, well, they already have been, but they are increasingly understanding the value of a healthy workforce, especially with immigration challenges that are taking place. The workforce supply for many ag operations have dried up, and it's much harder to get quality workers. And so these ag operations are beginning to appreciate the business practice of maintaining a healthy workforce. And they're starting to invest more dollars, more time, more resources into maintaining a healthy workforce. And so I would encourage you to use COVID as an opportunity to market the services that you can provide through your clinics to all of these producers. Market to them, let them know, because I guarantee you, Annabelle can pipe in when she takes over. Many of these producers do not know the resources that they have available to them. They just don't know. They don't have the time to get out there and learn this and to see what is out there. So it has been one of our goals from the seats that we sit in, from a research perspective, from an outreach perspective, is to link you and your clinics and your services to producers. And so at the end of this presentation, and Bethany as well, they can provide you with our contact information. And if there's any way, shape, or form that we can assist you in connecting the dots, I like to say connecting the dots, joining producers with different services, that way we can provide more quality care and new services to these workers where traditionally they haven't been available. So let's see here. Is that my last slide, Annabelle, or?
Yes, that's the last
I'll let
slide.
Annabelle take over from here.
So it's kind of interesting, the really nice relationship Dr. Dufresne and I have. He really taught me how to work with producers. I brought the worker side because I was a worker once, and my parents were workers, and my grandparents, and so it really helped me to put these two worlds together, which are very different but have a common goal, which is to keep everyone healthy and safe on the farm. And so just to give you some specific ideas of how we were able to not only access the industry but maintain the relationships, we're kind of systematic and stepwise. We, for those of you who said, I think it was 30% individuals that are from universities or educational centers, start with your extension specialists. Those are individuals who kind of play both fields. They're in academia, but they also have this large network within the industry. So try to see if you can reach out to an extension specialist in your area or in your field, if it's in farm work, or if it's in dairy, or if it's in feedlots, wherever it is. Try to reach out to them and try to see how you can start a network or a collaboration with them. We also, from then you get introduced to the industry associations like the dairymen's associations across every single state. You can find those, at least in our part, but there's, individuals like the Farm Bureau that can help you look for smaller farms or larger farm scales that you want to get in contact with. And then it kind of leads you to these producer conferences where you can go and go to these specific meetings where you're talking about, things like health and safety. Just like early last month, I was in a conference, the High Plains Dairy Conference, and there was a mixture, I would say 1/3 of producers and supervisors, some that I had already had relationships with in the past 6 years, and some who were new. And I was able to introduce myself through these other producers that I already knew. There was academics in there, so people that you can do research with, and there was other people from other industries, so seeding companies and genetics companies. And so these producer conferences are very interesting because they really know how to balance out all these sides of ag. And then also not being scared to start collaborations with other individuals across state lines or across other counties to try to help each other and try to see how you can better what you're doing and what you are servicing. And lastly, trying to publish your work in not only, especially for I think this goes more for academia, is to try to publish your work in yes, peer-reviewed journals, but also in targeted articles and magazines for producers, for the farmers that are able to read this. Because ultimately what we're trying to do is trying to put our research into practice and trying to disseminate our findings not only to the scientific community, but to the people that we're serving, and not forgetting that part. Now, as far as once you kind of establish it, as far as maintaining them, and I know we're kind of beating a dead horse here, but it's establishing that trust first and foremost with the producer, because then it kind of trickles down. Then you're able to get in contact with a manager, and usually that manager has been there for years. He or she is a veteran of the farm or of that crew that is working. And then you're able to get to the workers because the workers trust the manager. And again, following up and not being scared to cold call. We cold called for a project we had in the past 2 years. We were trying to do a tuberculosis knowledge and awareness survey, and it was in a specific county. And so I think we only knew one producer in that county, and there was 10 different farms. So what I did was that I went through, Texas DSHS has a list of raw retailers and dairy licenses, and they literally have the name of the owner, their phone number, and this is all public information that you could request, and you could just go down the line. And that's exactly what we did. And we thought, man, we're going to get a lot of doors shut in our faces, just, calling or showing up. And it wasn't anything like that. And it's like Dufresne said, and like Bethany, they want to tell you about, their system. They want to tell you about their farm and their operations, and they are very interested in how you can help. And so we were able to get every single farm on that list to participate on our survey. And again, when you do go to a farm or you go out to a field, make sure that you're respectful of their time and their business. Especially in dairy, it's such an integrated system of many moving parts. You don't want to throw a wrench in any of that or mess up what they have. Try to be respectful of that and understand their production practices. Now, as far as accessing the workers during COVID and what we're talking about in this webinar, this is kind of, we don't have that timeline of going to conferences and, having that time to network till you get to the point where you can access the workers on the farm or in the field. But you have to go through the employer again. I think the most aggressive thing to do in this case, especially because we're going through a global pandemic and we're trying to help workers in the now, is to still go through the producer, the employer, and try to cold call. Go to the Farm Bureau, try to get a list, go down the list, call it over and over again. You'll get a phone call, you'll get a response from someone, sometime or another, and you'll be able to access like that. And once one employer trusts you, it can open the door for other employers to let you into their farms or onto their fields. Again, communicate your willingness to help in difficult times, that you're here to help. Make sure that you're able to concisely and smartly tell your story and what you have to offer, and that they are very genuine services that you want to offer for the health and safety of the workers. Communicating, especially during this time, not only that COVID prevention is important in the workplace, but also that it's a tool that you take over to your house, that in the house you also have to be preventing COVID and transmission, staying in, not going to events, not going to get-togethers, disinfecting, all the prevention guidelines that are being recommended by the CDC. Also, again, emphasizing your services. Come prepared. Have a pamphlet. Have something tangible that you can give them that they can read. And even if they don't get back to you or agree that moment, they will come back to you in a couple of days. I've sent emails from months ago and I get responses literally a month or two later. But it's that persistentness. I call myself annoying, but a good type of annoying. I try not to push too hard, but I do stay on top because I understand that they might get a text and they might not even read it, and they might read it a couple days later. And so I just try to push a little bit just to remind them, hey, I'm here to help you. And if available, try to attend any kind of local producer meetings. You might find other individuals in there that might help you. Now, if you are delivering any services on site, which is a very great way to go, is to present right off the bat the COVID policies and procedures that are the guidelines by the CDC, and have those ready to be presented to the workers and the employer. Try to set up, away from the harvest or away from campsites if y'all are targeting any of the migrant campsites, or off the dairy or off the property. See if you can hand out, again, materials with pictures, vivid information, a phone number they can call. Is it in English? Is it in Spanish only? Is it both? Try to see if you can get some PPE out there, maybe some surgical masks, maybe some N95s if available, or just a tiny little bottle of hand sanitizer to emphasize and to educate on COVID and why it's important for them to not only protect themselves, their coworkers, but how this trickles back to the household. And if you are already there, try to establish a follow-up date. Try to see, hey, can I come back in 3 months, or can I come back in 6 months or in a year? Set something up so it's on a calendar and you can have an excuse to call this producer or this employer back. Say, hey, I'm still here. We're still set for, April 20th. We'll see you there. And so make sure that you have that in mind, because it can help you with solidifying this relationship that you started for COVID, but that you can maintain for other services that you offer as well. And I'm not sure if COVID testing is available. I know it just in general, there's been a shortage nationally, but if this is available, this could be a really big hit, and something that, if you say, hey, we've got 15 kits of COVID testing, can we come to your farm? This could be something very lucrative that can get the producer, the employer on board. And that is about it. Again, I'm Annabelle, and this is Dr. Dufresne, and these are our emails. If you have any questions, or if you feel like we can collaborate in some way, or if you just want to talk about anything, just give us a call or give us an email here. We're happy to help you out.
Okay, thank you, Annabelle and David. That's great information for everyone. We did have one question come up in the chat as you were speaking, and that was asking, let me get to that. What exactly is an extension specialist?
I think you're muted, Dufresne. I'll let him take it.
Okay, I'm unmuting him. Got it. You're unmuted,
Okay.
David.
Okay. That's a very good question. So we refer to the extension specialists or extension agents. Very briefly, the whole extension network or service, it goes back to the late 1800s. I think it was the Hatch Act of 1887. There's another act in the early 1900s. Basically, it set up our land grant institution network. So every single state has a land grant university. Here in Texas, it's Texas A&M. Oklahoma, it's Oklahoma State University. New Mexico State University in New Mexico. And so all of those primarily house the agriculture, research, and instructional services at those universities. Part of that, it creates the extension specialists and extension agents to where those personnel, which are paid by the federal government, they are mandated to go out and help ag producers across the state in all of the different commodities, whether it be dairy, different crop commodities, or even beef production. And so they have extension specialists that cover the whole state on a specific commodity like dairy, but then each county in that state has county agents, and they go out and they provide services, instructional services, resources, everything for the rural areas, especially the ag producers in those different counties. And so when we say go and look up and find extension specialists or extension agents, that's what we're referring to. Take advantage of the land grant universities and the extension network in each of your states. That'll provide outstanding resources and to get you in the door for many of these producers.
Okay, any other questions? Okay, it looks like there's another one that came in. Is there any work going on to assist producers with identifying new opportunities for their products, such as tapping into local sales or products?
I'm muted. Let's see, you're unmuted. So yeah, that is where the extension specialists and extension agents come in. They are not only providing resources and information to tap into new markets for producers. So that's where that's really the purpose of the extension network, is to provide those services, those resources. Yeah, that is going on a lot across the country.
Okay, any other questions?
I think Bethany has something to say.
Okay, let me see if I had unmuted Bethany.
Thanks, Sylvia. I just wanted to jump in because even though it is really tough on a lot of these producers that have been selling to, to the wholesale side of things like the education sector, it is really booming for small farmers that sell directly to customers. They're expanding production right now, and they're selling like crazy, especially farmers that do, like CSA, community supported agriculture. Those people might be hiring some of these people, and a lot of those people are very small, but because they're ramping up production, they might be taking on new workers. And so those folks may not really know anything about how to manage a workforce, especially their health and safety. So that may be a good thing to think about in your area, especially if you're near any kind of major city that might have like a local food kind of culture. Because a lot of times there's young farmer coalitions and other small farmer groups that may be hiring new workers and may need help from you guys.
Yeah, just to tag along there with what Bethany said, go to your local farmers markets and take your business cards, start talking to your local producers, and it's those simple interactions. One interaction leads to another interaction, and you get introduced to somebody else, and then you start establishing your name and the organization that you represent in the network, and then eventually they're going to be calling you for help on different subjects. And so that's a great idea, is to go to those local farmers market and start establishing relationships there.
Let me share. Go ahead and keep typing questions in the chat box, and I'd love to hear also from people that have relationships with producers. If you have any tips that you want to share on how you got those started. But let me share a couple of resources real quick for you guys. Sylvia has the slides pulled up. On our webpage, we have been pulling together some COVID resources for, for giving to farm workers as well as to employers, as well as resources for health centers. You can go to that webpage and find some resources. Sylvia, could you go to the next one? Another great resource we have is the Call for Health line, or the Una Voz para la Salud. And this, farm workers or health center staff can call this line and get assistance with finding healthcare resources in their area for farm workers, trying to figure out where COVID testing may be available. And we also have some funds set aside to help farm workers pay for medical care. So please call this line if you have questions about that. And we have one more resource, if you could share that, Sylvia. NCFH is part of a campaign to get masks out to farm workers as well as to healthcare workers in rural areas. And so we are working with a bunch of groups that are making medical grade and non-medical grade masks, as well as some prepaid Wi-Fi hotspots, so that farm workers can be communicating with their family and maybe access telemedicine services. So if you're interested in anything about that campaign, if Sylvia will go to the next slide, there's a phone number or an email that you can call to find out more information about that. Okay, good. It looks like Gladys had a question. She asked if growers have considered partnering with nonprofits and charities to provide surplus foods to vulnerable populations. Dr. DeFrey, did you want to respond verbally to that as well?
Yeah, I just typed in right before this webinar. I saw that it was announced by Sonny Perdue, our Department of Ag Secretary, that the overproduction, dairy and poultry, beef, pork, they are coming up with avenues to move the overproduction into the food pantry network, as well as to go into international regions of need. That means converting liquid milk to dry milk, powder milk, and then how they would transfer the meat products over to international areas. So that is being worked on. I don't know how they're going to do it, but that is an opportunity for even the, down at the local level. How can their production contribute to those in need? And so we're starting to see those food pantry lines, long lines here in San Antonio. So it's a big issue, and I think a lot of producers are looking for opportunities to make donations for those purposes. It's an excellent point.
Okay, thank you, David. And we have another question that came in asking, are the various farm owners connecting with the Migrant Clinician Network?
So if somebody from MCN is on this call, that would be great for them to answer. But from my work with MCN, they mostly are working with health centers to connect farm workers to that great service that they do in terms of tracking medical records and things like that. They may be doing that, but mostly what I know is they're working directly with the healthcare providers on that.
Okay, and it looks like another one came in. Are you aware of any formal community networks between producers, hospitals, and long-term care?
When you mean long-term care, what kind of connections are you alluding to there?
Skilled nursing.
Skilled nursing. Gosh, good question. I have not come across any type of formal relationships that are linking producers in long-term care, but that's an out-of-the-box idea. I kind of like that idea. But no, in my experience, I have not observed such a partnership.
And it's kind of limited. I was doing a lot of work trying to find all the rural health clinics that would offer free vaccinations or low-cost vaccinations for workers and their families, like in the Texas Panhandle. And some of them, I mean, it's just a list. Again, I'm a caller, so I just call down the list, and it's very limited. Each county has very limited clinics, and if they're lucky, they have one hospital that's operating with at least one physician. So it's kind of hard to establish those. I think hospitals, it's like you think Lubbock or Amarillo, especially in that area that has the bigger hospitals, and it's usually for bigger things and not, you know, this preventative health and ongoing just health checkups.
Okay, and then we have one other question that came up. In Connecticut, we have the CRVFHP that provides outreach and care to agricultural workers at various FQHCs. And I'm thinking that those are the acronyms for the Mass League of Community Health Centers. Is that correct, Benny? Yes, that is. Okay, then we have another comment that came in. Looks like Washington MEP has a program currently with MEP funded nurses reaching out to families. And of course, in limited capacity to ensure safety. And then Matthew has commented, in the Texas Panhandle, Amarillo area, there is Regents Health Network that may be able to be of help.
Yeah, Matthew, thanks for piping in there. We'd like to talk to you about some projects that we might be doing up there in the Panhandle. I'll get your contact information.
Okay.
And I will say we heard some in the last seminar or the last webinar that we did last week. There was some really good examples of collaborations that folks had built. And I remember one was in Arizona with some health centers that have been working with the state monitor advocate, who is a person. There's a person in every state that oversees different migrant housing and migrant labor camps. And so they have a lot of connections to producers and to farm workers. And they had built this big collaboration with health centers and with them and with producers. And they were getting other producers in that collaboration to reach out to producers they knew to try to get them in, to try to get healthcare services for their workers. So there's tons of great ideas. So I'm happy you guys are sharing some more.
Yeah, and I would be remiss, and I would actually get in trouble for failing to mention the NIOSH Ag Centers that are spread out all over the country. There are 10, 11. I don't know if all of you or if some of you are not familiar with the NIOSH funded Ag Center Network. And these are federally funded Ag Centers that are designed to be spread out all over the country to address agriculture, health, and safety needs among producers and their workers in these different regions. And so that's the network that Annabelle and I have traditionally gone through. And like I said previously, I'm associated with 2 different Ag Centers, but I work very closely with all the different Ag Centers across the country. And so oftentimes when I'm working with producers up in New York or Idaho or Nebraska, I always make a point to link the producers up with their regionally affiliated Ag Center. And those Ag Centers offer a wealth of information and resources. And so I would encourage you to look into that network as well. And if you have any questions on that, give me an email, or Bethany or Annabelle, and we can hook you up with those.
Okay, perfect. And then someone has shared that HRSA.gov has information where you can find a health center, do a search for the health center in your area, which is a very good resource to have. It does link you to the health centers in your area. Any other questions?
Thank you, everyone, for joining us, and we hope to see you next week when we talk about social determinants of health.
And then we do have part 4 following that, effective diabetes prevention and management during the emergency situations. That will be on April 29th. And here are some references and contact emails for our presenters, Bethany, Annabelle, and David. So if there are no other questions, this concludes our webinar, and we will send out copy of the PowerPoint after. Be sure to also complete the evaluation you receive. And once this recording is ready, we will post it on our website with our archived webinars. And as mentioned, please feel free to send us any questions you may have. We'd be happy to help answer those for you. Thank you so much for joining us. This concludes our webinar for today.
Thank you.
Thanks, Annabelle and David.